Hello, everyone. My name is Dennis Yang. I'm the Director of Third Space Endoscopy at the Center for Interventional Endoscopy here at Advent Health Orlando and Professor of Medicine at Loma Linda Health in the University of Central Florida. On behalf of my co-authors, I want to thank the editors of Gastrointestinal Endoscopy and all the viewers for allowing us to discuss our recent study titled Development and Initial Validation of a Video-Based Peroral Endoscopic Myotomy Assessment Tool. As we all know, peroral endoscopic myotomy or POEM has become a widely accepted treatment for achalasia with excellent short and mid-term clinical outcomes. Yet, despite its increasing adoption worldwide, little is really known about the cognitive and technical skills in POEM. As such, quality indicators for POEM have not been established, and there's significant variability in how training is currently provided. The use of video to assess and enhance technical proficiency has emerged as a viable approach to improving performance of surgical endoscopic procedures. In this study, we hypothesized that technical skills in POEM can be measured by analyzing procedural videos, and we aim to develop and establish initial validity evidence for a video-based POEM skill assessment tool or POMAT. The process by which the poem specific assessment tool or POMAT is shown in this figure. For the initial phase, the task was to break down poem skills into its basic elements by viewing and discussing videos. Following this exercise, the POMAT working group met and reviewed the tool, removing any elements that could not be adequately assessed by video. The first version of the POMAT was then distributed in survey format to 18 experts from the US, Europe, and Asia who were asked to independently grade each element on a 5-point Likert scale. Elements rated as essential and somewhat essential by at least 80% of the panel were then preserved and the rest of the items were removed. Following this, the POMAT underwent two more iterative processes with the goal of refining the elements and descriptive anchors that would help provide differentiation along the scale for each element. The final POMAT version was then distributed to another 12 experts who were asked to use the tool to grade 10 videos. The final POMAT version contained these elements of part of the skill assessment. The ones highlighted in orange were the elements that were deemed to be core elements for the procedure. This is a screenshot of the final format of the POMAT that was given to the assessors. Short video segments followed by grading scale with appropriate descriptors were used to guide the assessor in assigning a particular score based on the endoscopist's performance for that specific task. For instrument validation, the generalizability theory or G study was used to assess the relative contribution of all sources of variability in the instrument, which would include radar stringency, POMAT elements, or endoscopic performance. This in turn allowed the estimation of the relative influence of each source on the overall POMAT score by calculating the G coefficient score. A score equal or higher than 0.7 was considered satisfactorily reliable, and one between zero point 0.5 to zero point 0.7 as modestly reliable. The G study results are summarized in this slide. Overall, differences in endoscopist performance or true variance accounted for 8 to 25%. Assessor variance, which depicts a radar stringency or leniency, accounted for 2 to 20%. Conversely, most of the variance was attributed to the interaction between endoscopist performance and assessor, suggesting low agreement among the raters. When looking at the G coefficient score, 4 out of 5 core elements for POEM crossed the threshold for modest reliability. Submucosal tunneling and myotomy met the threshold for modest reliability, whereas active hemostasis and mucosal closure crossed the threshold for satisfactory reliability. So, in summary, through a rigorous, stepwise, evidence based approach, we develop a tool specifically designed to assess technical proficiency in poem based on video analysis. This video based poem assessment tool has far reaching implications, not only in training and postgraduate coaching, but also in quality assurance initiatives and potentially in credentialing. Now, there's still multiple issues with the current iteration of this tool, and it does not meet the necessary criteria for formative assessment at this stage. Additional research is needed to further improve not only the reliability, but the discriminative validity of this tool. Having said this, we believe our study provides important initial framework for a video-based tool for poem skill assessment, which is currently a gap in both training and practice. Once again, we thank you all for turning in into this author's interview and certainly encourage everybody to learn more about our study by reading our full manuscript in GIE. Thank you.